In psychiatry, one of the most challenging conversations is when family members strongly disagree with the treatment plan. Maybe they want admission when the patient refuses. Maybe they reject medication. Or perhaps they believe that the patient is fine. In the MRCPsych CASC, examiners are assessing not whether you win the argument, but whether you can manage the conflict professionally, empathetically, and safely. In this video, we will cover a practical CASC approach. Look at this scenario. You are the psychiatry trainee. A patient with bipolar disorder is agreeing to start lithium. However, the patient's husband strongly opposes medication, saying, "Lithium will poison her. I won't allow this." And your task is to speak with the husband regarding the treatment. So the first step to deal with this situation would be to start with rapport building and not defending. So when the family member says something like, "This treatment is dangerous," the candidate can respond as, "I can see how worried you are about your wife, and it's clear you want what's best for her." Then pause for a few moments and then say, "Before we discuss treatment, I would like to understand your concerns better." So, never start by correcting the family member or the role player. Start by validating the emotion. Families often calm down when they feel heard. The second step is to explore the reason for disagreement. Ask, "Could you tell me what specifically worries you about this treatment?" Now, the possible concerns why the family member is refusing this sort of a treatment could be side effects, some previous experiences, some sort of cultural beliefs. They have received some misinformation online, fear of dependency to the medication, or feeling excluded. It could be any of these concerns. So it is important that the candidate asks what specifically is worrying the person about this treatment. So ask questions specifically like, "Has anyone in your family had difficult experiences with psychiatric medication before?" So could that be a reason? So don't assume resistance from the family member is equal to non-compliance. Often there is a fear behind that resistance, and it is important that we understand what exactly is that specific fear. Step 3 is to acknowledge without agreeing. So when the family member says a concern like, "Psychiatric medications change people," the candidate will respond in a way that the candidate has acknowledged the concern but is not agreeing with the same. So things like, "I understand why that might feel frightening." Notice the acknowledgement. At the same time, untreated illness can also significantly affect someone's well-being. So the candidate is gently trying to show the other side of the coin to the role player. So validate feelings without endorsing inaccurate beliefs. The next step, step 4, is to clarify confidentiality and decision making. So candidate can say things like, "I would like to explain how treatment decisions are made. As your wife has capacity to make decisions, her views remain central in planning her care. I value your input, but ultimately we work collaboratively with her." So this demonstrates capacity principles, patient autonomy, and professional boundaries. Step 5 is to provide clear, simple information. Candidate can say things like, lithium can be very effective in preventing mood episodes. We also monitor blood levels regularly to make sure it remains safe. We would discuss side effects openly and review treatment closely. So use simple language when you are talking about medications or explaining a diagnosis or the treatment plan. Always avoid medical jargons. Step 6 is to involve the family member constructively. So the candidate says, you play an important role in her recovery. Would it help if we discussed warning signs to monitor together? Or arranged a family meeting so everyone feels included? So what the candidate is doing by saying all these things, the candidate is trying to turn the opposition into partnership. And that is the key to manage a family member who is not in agreement with the treatment plan. Step 7 is to manage persistent conflict. Now, even after doing all these things, if the family member says, I still won't accept this. So in that case, respond again gently by saying, I respect your concerns even when we don't fully agree. My responsibility is to ensure your wife receives safe and evidence-based care. I'm happy to continue discussing your concerns. So, whatever is the situation, always stay calm, don't become defensive, and don't argue. Examiners love hearing these phrases. I can see this is distressing for you. Help me understand your concerns. As long as the patient has capacity, I would like us to work together. Safety remains my priority. So try and use these phrases in your conversation with the role player. Avoid arguing with relatives. Avoid quoting legislation too early in the conversation. Avoid ignoring emotions. Avoid being overly technical, and avoid breaking confidentiality. Remember, in CASC, difficult relatives are rarely testing your medical knowledge. They are testing your communication under pressure. Listen first, validate emotion, protect autonomy, maintain safety, and that's how you pass. So if you would like to receive such CASC tips on a weekly basis, don't forget to subscribe to the channel and share with anyone who is preparing for CASC. Thank you and see you in the next video.